The ulnar nerve, anatomy and palpation. The ulnar nerve can be palpated along its length. Key areas to palpate are the wrist and the elbow. At the wrist, at Guillen's canal, the nerve is vulnerable, for example in cyclists, and can be easily palpated. It can be also palpated at the elbow. Note the triangle I've formed, and I'm now flicking over the nerve where it's vulnerable as it goes into the flexors. The nerve can also be palpated in the upper arm. Active quick test. Ask your patient to put their hand on their ear and point the fingers down towards their back. This challenges the ulnar nerve and will evoke symptoms in most people with ulnar nerve problems. Therapist assessment. The upper limb neurodynamic test 3 from the wrist first. Note the position here. Claire's elbow is resting on my thigh, its wrist extension, pronation, elbow flexion, lateral rotation. Now my hand comes in, blocks, leans on the bed and depresses the shoulder, and I'm using my thigh to abduct the arm. Here's a side view. In this position, I can also ask Claire to flex her neck to see whether it changes symptoms. Therapist assessment, the ULNT3 from the shoulder first. Using order of movement principles, the ulnar nerve test can be performed from the shoulder. Depression, abduction, lateral rotation, elbow flexion, wrist extension and pronation. In this position, tucking the chin in or laterally flexing the neck away provides opportunities for structural differentiation. A handling variation of the ULNT3. It's a quick test, but if you note here, I've got her wrist extended, elbow flexed, and I'm simply depressing Claire's shoulder. You could also add a little shoulder abduction if you wished. At the same time, I'm doing a slider technique. Passive techniques. In ULNT3, massage on the cubital tunnel. Here Claire is in the ulnar nerve challenge position, and I'm performing a massage technique where the nerve goes into the flexors. It can be done more gentler as a slider or more aggressively as a tensioner. Passive techniques in ULNT3 are piezoform mobilisation. Perhaps useful for a cyclist who has persistent problems in the pinky. Claire is in the ULNT3 position, and I'm doing combinations of massage and wrist bone mobilisation. Passive techniques in ULNT3, slider tensioners. Here's a slider technique as the shoulder girdle depresses. I can ask Claire to extend her neck. Or if she was to tuck her chin in, that would be a more aggressive tensioner technique. Can you see if you had the other arm in a neural load position, it would be even more aggressive. Self-management, gentler movements. Don't listen. This is a functional position, same as our active quick test, and an easy way to mobilise the ulnar nerve. Self-management, gentler movements, make a halo. I've asked Claire to make a big zero around her head, or imagine she has a big halo. Notice how the ulnar nerve must be mobilised. Self-management, gentler movements, face massages. The action of taking your hand on your face, massaging, or if too sensitive, just covering the face, is a functional way of mobilising the ulnar nerve. Pointing to your ears, pointing to your nose, and chin and forehead adds a little extra to the mobilisation. Self-management, gentler movements. Smoking. Even the art of smoking is a way of mobilising the ulnar nerve. The patient doesn't have to smoke, they can just imagine they're smoking. Self-management, gentler movements. Yahoo! It's like a halo. It might be more appropriate for some of the Westerners. But to form a big ring around the head, imagining you're lassoing, is a great, more aggressive way to move the nerve. And it's a bit of fun. Self-management, stronger movements. Don't spill the wine. Imagine you have a glass of wine on that plate. The trick is to take it from above, below, and get it back up again. There's a lot of distraction there and lots of neuromobilisation. Self-management, stronger movement. Dry the back. Here's an action we do every day. It's functional and it's a great way to mobilise the ulnar nerve. Don't forget to do it both ways so the arm can be pulled under as well as above. Self-management, stronger movements. Sunglasses. Some patients can do this. Try to make a pair of sunglasses. If you do it and laterally flex your whole spine, you'll even add more neural load. You can do it with one arm or both. Self-management, stronger movements. Crawl to the pits. I've asked Claire to just creep up the side of her chest towards her armpits. Notice how she laterally flexes at the same time, mobilising the ulnar nerve.